everyone and welcome to Dr. Dad Talk Show. I'm your host Indubala and today I would like to introduce Dr. Ramnik Sabharwal, Gynecologist. Welcome to our show, ma'am.
Thank you, Indu.
Ma'am, please tell me about yourself.
Okay, I'm Dr. Ramnik Sabharwal, an Obstetrician and Gynecologist, and working in Delhi in Shri Jeevan Hospital and Fortis La Femme Hospital and Rose Walk Hospital. And I have been trained in adolescent medicine also, and so this topic is very close to my heart. And being a mother of teenager,
Oh really? You're a mother of teenager? You are not look like?
Yeah, so this is a topic which is, I think, need of the day.
Yeah,
and
yes,
very close to my heart, so I'm very happy to talk about it.
Thank you so much, ma'am. Shall we start the questionnaire?
Yes, of course.
Okay. Ma'am, one audience asked this question. As a seasonal gynecologist and obstetrician, what are some common concerns or misconceptions you often encounter among teenagers and their mothers regarding reproductive health?
Yeah, firstly, it's very important that we have to educate these boys and girls that the changes that they're encountering in puberty are normal for their body. Secondly, I very commonly encounter mothers saying that okay, now she has started her period, so she can't go for sports or for swimming. So I want them to understand that everything can be done when the girl is having her periods. Even swimming is possible. And sometimes they start using commercial washes. So I don't really advocate that because it destroys the normal bacterial flora. And just normal education regarding hygiene, frequent changing of pads, all these things have to be explained to them.
ये मैम ऐसे आपने सही बताया कि कई पेरेंट्स हैं जो मदर स्पेशली कि जब पीरियड्स वगैरह बच्चों को शुरू हो जाते हैं तो वो मना कर देती है कि नहीं आप ये नहीं करोगे, तो आपके थ्रू हम ये बता पाएंगे पेरेंट्स को कि ये सब चीज़ें मिथ हैं, आप इन पे ध्यान मत दीजिए, डॉक्टर को फॉलो करिए. Okay, next round. What advice do you have for mothers on effectively communicating with their teenager about puberty, menstruation and sexual health?
Okay, firstly, जो भी communication है, it has to be clear and very consistent. It has to be done on a regular basis because teenagers जो हैं, they have very fragile feelings and their feelings and emotions change every day. Every day they encounter new experiences, so it has to be very consistent. You can't think कि एक बारी बता दिया है तो बस ठीक है.
Yes, right.
You have to be very open about sex, about reproductive health, about periods, everything with both boys and girls.
That's true, ma'am.
Also about sexually transmitted diseases.
Okay. Next question. For teenagers who may feel uncomfortable discussing reproductive health with their parents, what resources or support system do you recommend they seek to?
Well, there are a lot of resources available nowadays on social media and on internet, but I really cannot endorse any one social, point from where I would feel they can get information. I would really plea all the mothers and fathers to have a good relationship with their children where they can talk to them freely because they are the best source of information.
Yes, ma'am.
And when they know everything from their parents and they are scrolling on the internet, they can decide what is right and what is wrong, and they can also feel more confident.
That's right, ma'am.
Really, yeah.
वैसे भी आजकल क्या है कि सोशल मीडिया आजकल सबका पर्सनल फोन है अपने पास, बच्चों के पास, तो उससे भी उनको सब कुछ पता चल जाता है, लेकिन फिर भी पता नहीं क्यों पेरेंट्स इतना क्यों घबराते हैं उनको सेक्सुअल एजुकेशन देने के लिए.
एग्जैक्टली. एंड ऑल्दो ये कई सोशल प्लेटफॉर्म्स हैं जिनमें एज रिस्ट्रिक्शंस हैं, दैट लाइक आई थिंक इंस्टाग्राम यू कांट बी बिफोर 14, बट आई हैव सीन सो मेनी चिल्ड्रन यूजिंग इट. सो एवरीथिंग इज ओपन, सो यू पेरेंट्स आल्सो हैव टू ओपन अप so that the kids can decide what is right.
That's right, ma'am. How can mothers navigate the delicate balance between respecting their teenagers' privacy while still ensuring they have access to accurate information and healthcare services?
Yeah, I feel it's very important to give them their privacy, and we have to ensure that they are safe. So I feel parents should also form a bond with their friends in school, with people that they are interacting, so that all of them feel comfortable around them.
That's right.
And we, as parents, we also feel happy that we know who our kid is interacting with.
Okay. In your experience, what are some key signs or symptoms that a teenager may need professional medical attention regarding reproductive health issues?
Yeah, so in girls, if there are signs of anemia, like excessive tiredness, lethargy, that means during periods the blood loss is excessive, then they require medical attention. Sometimes hypothyroidism also develops during this time, and signs and symptoms could be depression or constipation. That also warrants medical attention. And irritability or any mental well-being problems should also be addressed as quickly as possible.
और मैम ये कई मतलब गर्ल्स को है, टीनेजर्स को, लाइक कि पीरियड्स काफ़ी ऊपर नीचे हो जाते हैं, तो क्या इसके लिए आप कुछ बताएंगे?
Yeah, for the first 3 years after the period start, the periods are usually irregular, but still we cannot ignore it. I feel like basic checkup आप अपनी gynecologist से करा सकते हैं, and it's also very good that you got your child in touch with a reliable doctor and she can share whatever she wants with the doctor.
Okay. Ma'am, what role do you believe schools should play in educating teenagers about reproductive health, and how can parents complement this education at home?
Yeah, I definitely believe that schools should have regular seminars for children, and starting from grade 4, because these days we also encounter early puberty. So they have to educate the students in school also regarding puberty, regarding sex, regarding pregnancy, regarding sexually transmitted diseases, everything. And pads and tampons, everything should be available in the school. And I think it goes a long way, because children absorb a lot from schools, even more than their parents. They absorb a lot from schools.
Absolutely, ma'am.
Yeah.
Okay. And with the rise of social media and online information, how can parents help teenagers discern reliable sources of information regarding reproductive health?
Yeah, I feel parents is the most reliable source. There are a lot of sources on internet, but they're all general. I haven't still encountered any particular thing for teenagers. It's just there are a lot of forums for sexual health, everything. So everything is quite open, and they should definitely communicate with their parents.
बट आजकल इतना ज़्यादा हो गया है, लाइक मतलब सब बच्चों को सब कुछ पता है मैम, लाइक टीनेजर्स को अपनी हर कोई इन्फॉर्मेशन वो सोशल मीडिया के जरिए ले लेता है, लेकिन फिर भी पता नहीं क्यों पेरेंट्स क्यों इतना ज़्यादा लाइक डरते हैं या क्यों नहीं बता पाते.
Exactly, that is what is needed, because to guide your children you have to know what they are doing and you have to act accordingly. एंड घबरा के या शर्मा के ऐसे कोई फायदा नहीं होगा.
बिल्कुल मैम, मैं आप ही के द्वारा लाइक बताना चाहती हूँ कि पेरेंट्स इस चीज़ को समझें कि डॉक्टर भी ये कह रहे हैं कि आपको अपने बच्चों को सेक्सुअल एजुकेशन देना बहुत ही ज़रूरी है, तो प्लीज़ आप दीजिए. इसमें कोई शर्म वाली बात नहीं है. प्लीज़ डोंट हेजिटेट. आपको बहुत ही ज़्यादा ज़रूरी है, जिस तरह से मैम ने बताया. आपके सामने मैम बोल रही है, शी इज़ एक्सपीरियंस्ड डॉक्टर, तो प्लीज़ इसे फॉलो करिए आप. Okay ma'am, next is are there any specific cultural or societal challenges that you are observed impacting discussions about reproductive health within families, and how can these be addressed?
Yeah, again the shyness around all the topics, that is the main thing that is affecting all this, and only an effective communication with your children can help the children and the parents both.
Yes, lack of communication.
Yes.
Okay. And for mothers who may have had negative experiences or misinformation about reproductive health in their own upbringing, how can they ensure they provide accurate and supportive guidance to their teenagers?
Yes, mothers should educate themselves, definitely, and they should also get their children in touch with a doctor, empathetic doctor who can understand what they want, and somebody who the parents also rely upon. I feel that's a very good medium, and that's how they can. I get a lot of mothers coming to me who say that I didn't know anything, so I had a lot of problems facing everything, but now I want my child to understand everything and
that's right,
go about in a better way, more intelligent way of handling things, and which I feel is a very, very good thing. So just educate yourself. There are many things available, and of course mothers with experience also know a lot of things.
Yes, ma'am.
And get them in touch with a doctor you trust.
Right, ma'am. What are some proactive steps mothers can take to empower their teenagers to make informed decisions about their reproductive health and overall well-being?
Yes, it's only education and communication on a regular basis, on a consistent basis. That is how they can empower their teenagers.
Okay. Everything is based on the communication gap, right, ma'am?
Yes.
And the lack of information.
Yeah. Or sometimes excessive information and not knowing what is right and what is wrong.
That's right, ma'am. Okay. Is there a key insight you wish to impart to those observing your presence?
Well, I think I've said it all, and my take-home message will only be an open communication with your teenagers regarding pregnancy, regarding sexual intercourse, regarding pubertal changes, and also regarding relationships is very, very important.
Thank you so much, ma'am, for sharing your expertise and providing valuable insights. And thank you to all of you for tuning in. Stay tuned for more informative information and content. Till then, bye-bye and good take care of yourself and your family, and keep watching Dr. Dad Talk Show.